Hey guys, got another video today, another pain video, to talk about another one of my conditions that I have. And it can be a hard one to deal with. It does change your life. And I would say some of the symptoms are the same as trigeminal neuralgia, some of them. But the way mine came about, well, actually, I guess I shouldn't be embarrassed to say how it came about, but maybe from my other videos, I did it to myself, because I damaged myself through a suicide attempt, because I have the pain suicide diseases, and I have 4 of them. And so I had the first one that I had, I went horribly untreated, undiagnosed that was for 18 years until I got my diagnosis, but couldn't tolerate my life. And a lot of stuff happened with these pain suicide diseases. And I'm definitely not wanted to speak about that type of stuff, but this is a reality. Now, I'm going to go back a little bit in my life to the very beginning of my pain. And I'm not sure if it was occipital neuralgia that began, but it certainly was with damage. You can see in my other, I have another video, and it's titled, so I'll do a bigger picture of me here, and then I'll get back to this. I have full body RSD, centralized pain, or the nociplastic pain syndrome. And it began because I was having a lot of convulsions due to a medication reaction in 2003. And there were so many of them that I tore my neck. That is the idea. Whiplash. I got a pain in the back of my cervical, right where get the pain in occipital, the lower to the back type thing, but it was in the lower, right in the C-spine. And then it spread over my face, and I was holding my face for weeks, and nothing was really working, and eventually it just started to die down on its own as I started to introduce painkillers and treatment, and I think it was just dying down on its own already. Apology, no apology, as this is the only time I have to do videos like this is when I eat. I have the ability to edit too, and I do edit other videos, but for this there's no need, so I just want to be straightforward. If you want to watch me because I edit videos more. So it wasn't until I damaged my neck in a very serious manner. I ended up with a brachial plexopathy, trapezial neuralgia from a tear of my trapezius. These are all permanent. So brachial plexopathy, torn trapezius, my sternocleidomastoid muscle is intramuscularly torn. All these things are uncommon things to happen. They're incidents. And you know what happened? The hospital only told me, and the radiologist, she told me, and I was hospitalized, that I only had a brachial plexopathy. And I only found out 6 or 7 years later that it wasn't true. There was much more damage. I couldn't believe what I found in my file. So it said like my lung was damaged, number one. They didn't tell me. My trapezius, so I wondered why. Just like the pain suicide disease, trigeminal, occipital, you can get it in your trapezius too, as long as there's a nerve there and a muscle. And I wondered, there was times where, like with a sternocleidomastoid tear, it's permanent. You and you can re-injure it. It feels like it's been torn all over again, and it may only last a day. It may last half a day. It may last 2 days. But when that would happen, it would set off my trapezius, and I'd be like, it was like burning, like a neurological burning, so bad that it was even hard to breathe. It would get that bad. So I had to learn to be careful how to move around. I stopped boxing. I stopped doing rapid movements, especially when I let go of Toradol, because Toradol will help stop those feelings. I know that's a neurological, but it was. Maybe because of an inflammatory response. But when I was in hospital with my brachial plexopathy, they didn't tell me that my neck was torn. I had a complete damage all around, everywhere. Let's just say that probably almost every nerve was hit. And I woke up 7 days into being hospitalized, so 7 or 8 days, to such a horrible pain in the back of my neck, whether that was a sternocleidomastoid or it was the beginning of occipital neuralgia. I don't know. I don't know. But I'm going to have to fast forward to it was there. It was underlying. I moved out here over 5.5 years ago. And about a year into moving here, I dropped something on the ground. I remember what it was. I dropped a candle out of my cupboard. And at the time I had my freezer, my like my metal, you could just see it in the back there. You can see like the shine, like right, anyways, like a Frigidaire metal, like you open the freezer and it's like sharp on its edges, right? So I went down and I got up real quick and bam, I hit my head. And then from that point, I've had it ever since, like to a different degree. Instantly and it just was like every day, the back, like the lower part of my neck would ache so much, and it would be the occipital part of my scalp. It would even go up, into my scalp. And what I started to notice was, like, I already have problems with like bright lights and stuff, and I have autism too, so like I tended to wear glasses. I desensitize myself now to them. I don't use glasses to the light anymore. I don't think it does you any favors. But I started to notice that I was like this. And this is what you notice in people with occipital neuralgia. They may have a look like they're mad like this, and they don't know. I remember messaging a woman and telling her she was giving the symptoms. And I'm like, look at the way you're looking. You're like this. It's because the lights are so bright. So it causes like photosensitivity. I wouldn't say photophobia. Let's just say you're sensitive to the lights. But what happens is, yes, you can have just a general aching in the back of your head. You can have that, and it can last for a long time. But you have to be so careful You can't have someone come up behind you and grab you, shake you. If you do that, you're going to set off occipital neuralgia. So there are many times, how many times in your life, when you're have your microwave thing open, if you have a higher microwave like me, I just hit it. Let's just say like, even, yes, just like that, sets off the back. I'd talk to doctors and they wouldn't know what I'm talking about. I think the incidence was 1 in 30,000 people to have this. And so mine didn't just come out of the blue, but I have a propensity for this, and it started back in 2003. Pardon me. Can make your forehead really hurt. I suppose. I don't really feel a lot, but I know it can make your face feel like it hurts, like suction sinusitis. But it's the back of the head and the base of the neck, and it can it wraps itself around. And we're talking about a pain level here that can get extremely high. I have trigeminal neuralgia, and I remember its attacks like at their highest, where it's just so dull, and then like stabbing. And I'm talking about a type of stabbing like no toothache or anything like that explains it. The only way to explain it is someone working and hitting a nerve. That's what it feels like, trigeminal. This is more like a dull ache in the back of your head and the base of your neck. But remember, and I would rather have occipital than trigeminal. I would, any day of the week. There are certain levels, but it's not. They're called the suicide diseases for a reason, and obviously there's a variability of a spectrum, just as with any disease, just with anything, right? So what do I do for it? I'll tell you what I do, and then I will look at some stuff here. It's very tough to want to move around because you don't want to move the wrong way. Both with a torn trapezius, sternocleidomastoid muscle, and occipital neuralgia. I wouldn't say trigeminal, because if I hit something, I don't tend to set that off. Not for me. No. Being careful with how you move. Being careful with how you move. It can be anxiety provoking to want to do certain things. But don't live your life being scared. It's no fun. You know what? I do 50 plus push-ups every single day now for years. And I do it very carefully. I'm very careful with what I do, like dips and arms and shoulders. Don't lift heavy weights. I do body weight. I do light dumbbells. I think it's wise to keep yourself, in shape, right? What do I do I don't recommend you take opiates or anything like that, but I have a throat that talking and doing this can make me choke. Yeah. You know what? I have adhesive arachnoiditis, which is a pain-suicide disease. Full body RSD, pain-suicide disease. I have trapezius, occipital, and trigeminal, which makes 5. I say 4, but I looked and trapezius is no different, so it really is 5. Here's what I find. When I get in major nerve attacks of pain, the only thing, sometimes opiates will help. You know, they always aid in relieving something. But what I find is that it's gabapentin. It helps nerve pain, restless leg syndrome, seizures. So obviously it's, certain neuronal pathways, right? I would get an attack where I couldn't even breathe. It was like, it feels like your bones are being crushed type feeling. And, you're just holding on. And I found that gabapentin. So I'd take it and it'd be like half an hour that it would work. I've had enough attacks so I got that injury in 2015. That's 8 years ago. Wait. That's 5. This is going on 9 years. I've learned to deal with this. And you know what? By taking Toradol away, I actually learned to live better. It's more pain, yes, but I got a feeling of what was going on much better than having, and I'm not telling you not to take meds. Don't ever take that from me. So let's take a look at it. Take a look at what the symptoms are. I'm on, what am I on here? WebMD. Pardon me as I chew. Occipital neuralgia is a condition in which the nerves that run from the top of the spinal cord up through the scalp, called the occipital nerves, are inflamed or injured. You might feel pain in the back of your head or the base of your skull. So there it is. So that's where I get them in both. And if I hit my head on something very lightly, that's all it takes is a light hit, right? Same with trigeminal neuralgia when it comes to setting off. It's not with me, but a lot with people it is. Well, it can be with brushing teeth and wind, but what was I saying? It doesn't take much to set. I can't remember what I was saying. People can confuse it with a migraine or other types of headache because the symptoms can be similar, but treatments for those conditions are very different. So it's important to see your doctor to get the right diagnosis and know the pain is not the same. It's called the suicide disease for a reason. But I'm sure some episodes could be. Occipital neuralgia can cause intense pain that feels like a sharp jabbing. A lot. When I talk, I get I have a difficulty speaking, and so it's called muscle dysphonia. It's not psychological, but it's kind of like dystonia. Some symptoms. You see me, I get breathy. It feels like a sharp jabbing electric shock in the back of the head and neck. Other symptoms include aching, burning, stabbing, throbbing. Typically starts at the base of the head and goes to the scalp. Yes, when I hit it very lightly, the time it takes for that pain to begin is usually no longer than 5 minutes. Pain on one or both sides of the head, pain behind the eye, sensitivity to light. There you go. So I pointed out to that woman, you're looking like this. Tender scalp, pain when you move your neck, and there's nothing wrong with using glasses if you really need to. It can happen when there's pressure or irritation to the occipital nerve. maybe an injury, tight muscles that entrap the nerves, or inflammation. Many times doctors can't find a cause for it, and that's many times. It's not easy to get this diagnosis. I wasn't diagnosed with this by itself. I was diagnosed with multiple injuries at once. Some medical, yes, and I say this, some medical conditions that are linked to, including, that's trauma to the back of the head, neck tension or tight muscles, osteoarthritis, tumors in the neck, cervical disc disease, infection, gout, diabetes, blood vessel inflammation. I was going to say, if you have this, you may want to get a check for MS, and you may, but that's mostly for trigeminal. So they'll do a physical exam, a medical history, any injuries, because a lot of the time people forget what happened to them, especially if you're older. You don't have to be older, you just forget. They'll firmly press around the back of your head to see if they can reproduce your pain. And I don't know if that would really work, but they may also give you a shot to numb the nerve, called a nerve block, to see if it gives you pain relief. If it works, be careful, by the way. Listen to my warning here of spinal injections, any type of invasive spinal injection that causes adhesive arachnoiditis. That's how you get that suicide disease, because the needle ends up going through the dura mater. I use an abbreviation, DAP. Wait, no, what is it? DAP, dura arachnoid pia mater. I use those types of things I can remember stuff. So they may give you a shot to numb the nerve, called a nerve block, to see if it gives you relief. If it works, occipital neuralgia is likely the cause of the pain. You might also have blood tests or an MRI. Listen, these are going to be pretty... It's not easy to get this diagnosis, guys. I think it's a lot of exclusion, a diagnosis of exclusion, and symptoms. And, the story, especially if you have an injury, you have to get the right diagnosis to get the right treatment. Make sure you find someone who you can trust. For example, if you don't find a good doctor, find another one. If you have it and you get a prescription for medication, you may not get relief. That is very true. Like I said, Gabapentin, take the smallest dose you can. Heat to the neck, rest in a quiet room. Yes, I say that. Massage tight and painful neck muscles if that's the issue, or you probably need one anyways. Over-the-counter stuff like naproxen and ibuprofen, those would help. I don't recommend taking those for a long time because those are NSAIDs on your stomach. If those don't help, prescription meds, muscle relaxants, anti-seizure, there you go. Carbamazepine, it's Tegretol, Gabapentin, and the generic name Neurontin. Antidepressants, be very, very careful. And then of antidepressants, listen, this is big pharma, guys. This is big pharma. You got to be careful. You don't want to end up on something you can't get off. Nerve blocks and steroid shots. This is where you have to be careful. Like, the reason I say this is because some nurses and doctors, mostly unprofessional people, but it happens with both, they will slip and fall. Okay? They slip and fall. This is your spinal canal we're talking about. The nerve block that your doctor might do to diagnose your condition can be a short-term treatment too. May take 2 or 3 shots over several weeks to get control of your pain. It's not uncommon for the problem to return at some point and to need another series of injections. I don't know if they're talking about just nerve blocks I don't know about, what's the other shot that they give? Botox? An operation is rare if it's bad enough. And then there's surgery and all that stuff. Nerve stimulators. But let's take a look. Let's take a look at a picture if I can able to make it big enough. If there's a good enough one. I hate it when you click these things. They don't let you do it good enough. Let me see here. Yeah, I can't really do it, but you can kind of see here. Pardon me. As you can see here, hot spots of pain due to greater occipital nerve. Wait. They're not even showing it. There's the sternocleidomastoid down there. Let's be careful of needles, guys, when it has to do with your spine. You have no idea what can begin. Always talk to your doctor about those types of things. I'll just go like this. I'll just go. And I'll go back to small occipital neuralgia images. And I'll go to all. See if I can make this bigger. No, it really won't. This is the best I can do here. So as you can see here, there is one occipital nerve located on each side of the head. Travels through, I don't know what it says here. Oh, crap. Yeah, this is, I don't like the way they do this. Sorry guys, like, it travels through the muscles in the back of the head and up into the scalp, sometimes reaching as far as the forehead. It does with me. The occipital nerves are responsible for feeling in the back and top of the head. Symptoms: sudden, pardon, I can't speak in. Sudden tingling, zapping, electric shocks, pain radiating through surrounding areas, spontaneous pain episodes. And, okay, so I've actually been over all this. But, yeah, so. Anyways, guys, thanks for watching this video. To tell you the truth, besides what I just said right in the beginning, like, there was really not a lot to say about this, and you may have a hard time trying to get a diagnosis, and you know, you're going to have to probably talk to a neurologist. They're going to be the ones to give you the diagnosis. I don't know. I never came across a doctor that was good enough just to write it down, even though everything that I had going for me was like completely overwhelming towards that. It just never turned out that way for me. God bless. Thanks for watching this today.